One of the very first things that has to happen even before we get the subjective assessment out of the way. And it's something that I just want to bring your awareness to, okay? And you're probably already doing it at the moment, okay? You're doing it really well with some people, and you're probably really struggling with other people. And that is building a connection with your patients. So what I want you to do this week in this episode's Build Your Business is I want you to bring your awareness for the remainder of this week and until next week's show is what do you do well when you've got a good connection with your patient, okay? So I want you to think about the times when you've got a great connection with that patient, and I want you to bring your awareness to what you're doing really well. What are you saying? How are you acting? Are you more relaxed? What are you talking about? And then I want you to look at maybe one or two patients where you just feel like you don't have that connection with the patients. And I want you to bring your awareness to your behavior, your thoughts, okay, what you're talking about there, okay? Because building connection is the very, very first step, okay? And this is not only a business tip, but it's a clinical tip as well. Because if we've got a good connection with that patient, they know, like, and trust us to a point, okay? And obviously we can't get to know, like, and trust them too much, okay? And I'm not saying tell them everything about your personal life, but we've got some kind of connection, then they tend to relax, they tend to trust you a lot more, okay? They're going to listen to you on a deeper level, they're going to commit to the program, okay? They're going to follow through and probably not drop off, okay, which we'll talk about next week. And there's a lot of good things happen as a result of doing one simple thing, and that's building a connection with your patient. Now, building a connection with a patient, it's going to be very, very easy if you're somebody who likes rugby league, okay? So if someone who comes in and they're a big rugby league fan, to me, that's obviously something that we've got in common, okay? We can build that connection of, chatting about rugby league. But someone who doesn't have the rugby league common, or might be Gaelic football or hurling for those in Ireland, or some other sport in some different country. But for those patients that you don't have that in connection, you still have a lot of things in connection. So for instance, a patient who has a young girl, okay? She has a young daughter, okay? I've got a young daughter, so we've got a second degree connection there that can just help break down the barriers a little bit, okay? So again, almost bring your awareness, okay? Take a step back and bring your awareness to how you're connecting really well with a lot of your patients. And the thing that I think you're going to find this week that you'll be pleasantly surprised with is a lot of the connection is built. In fact, I would go to say 99% of it's built based on non-clinical stuff that you're doing, you're saying, and how you're reacting, okay? So for a lot of therapists, you need to relax, you need to look the person in the eye, you need to listen to them properly, okay? The patient wants to feel like they've been listened to, you want to have empathy, okay? They're all things that's going to help build that connection. And then how you build connection with a specific person, obviously you're looking for bits with those as well, okay? So that's the first thing, build a connection with the patient. They'll start to relax, they'll move a little bit differently, they'll trust you, you'll get the buy-in, hopefully the adherence, that will all come on the back of that, okay? If you've no connection there, as you're explaining your findings, your pain science, whatever, you're explaining what you need to do. If the connection isn't there, then I certainly have had a few that comes to mind early in my career where the connection just wasn't there, and they may go see another therapist and they may have delivered the exact same program, but they've got a better connection. The outcome often is very, very different, okay? So there you have it for this week's Build Your Business. A little bit of homework, bring your awareness to the connection that you have with some patients, what you're doing, what you're saying, how you're acting, versus maybe some patients where you don't have that connection at the moment, okay? So they're the patients then where you may start to change your thought process, you may start to change your behavior a little bit, and hopefully then you'll start to notice a bit more of a better outcome once you start to look for those second or indirect connections that you have with that patient.